Welcome to Dr. Health Hub, where every episode begins with a doctor tip you can trust. Today we're talking about type 2 diabetes. I'm going straight in. If your lab says your A1C is 6.8 or your fasting sugar is 132, is that a little high or is that already diabetes?
That's already in diabetes range. We call it diabetes if any one of these is confirmed. Your A1C is 6.5% or higher. Your fasting sugar is 126 or higher after you've had nothing to eat overnight. Your 2-hour sugar after a glucose drink is 200 or higher, or your random sugar is 200 or higher, and you're having classic symptoms like constant thirst and peeing all the time.
So what about pre-diabetes? People get told you're borderline.
Prediabetes means you're on the edge. That's usually an A1C between about 5.7 and 6.4, or a fasting sugar from about 100 to 125. That is not you're fine. That is you're headed toward diabetes unless we change something now.
People always ask this, why did this happen to me? I was fine at 28, now I'm 45 and I'm diabetic. What changed?
Type 2 diabetes is basically your body saying, I can't keep up with the sugar load anymore. Your body stops responding to insulin the way it should, we call that insulin resistance, and your pancreas can't keep pumping out more and more insulin forever. Belly weight matters. Processed high sugar food all day matters. Not moving, poor sleep, stress, they all matter. Genetics matters a lot too. And we're seeing this younger now. It's not just something that happens at age 70 anymore.
Who needs to worry right now, not someday?
If you've ever been told you have prediabetes, that's you. You're already high risk. You're also high risk if you carry extra weight around the middle, barely move all day, have a parent or sibling with type 2 diabetes, had diabetes during pregnancy, or you also have high blood pressure, high cholesterol, sleep apnea, fatty liver, or heart disease. In those groups, they should not wait for symptoms. They should get checked.
Let's talk symptoms. How does diabetes feel?
Here's the sneaky part. Mild or moderate high sugar can feel like nothing. Most people feel totally normal. When sugar is really high, then you start to notice. You're very thirsty, you're peeing nonstop, especially at night. You're more tired, your vision goes a little blurry, cuts heal slowly, and you may lose weight you didn't mean to lose. But if you wait until you feel diabetic, you're already behind.
Okay, let's say I come see you and you think I might have diabetes. How do you confirm it?
We repeat the labs. We usually don't label you for life off one random number unless it's clearly high and you're having symptoms. So we'll recheck fasting blood sugar, we'll check A1C, and sometimes we'll do a sugar drink test where we measure your level 2 hours later.
And how do you know what type it is? People hear type 1, type 2, LADA, all that.
We look at the story. Slow creep over years, weight going up, blood pressure and cholesterol also high. That looks like classic type 2. If you come in very sick, sugar extremely high, you're losing weight fast, maybe nauseous, weak, dehydrated, that can act more like type 1 style diabetes in an adult. Those people often need insulin immediately. We don't treat every adult the same way just because they're an adult.
Let's do this part clearly. When is high blood sugar an emergency? I mean, go now, not call next week.
There are two big danger situations. First, sugar is very high and you feel awful. Weak, super thirsty, vomiting, maybe confused, can't keep fluids down. In type 2, we call one version HHS. In type 1, we worry about DKA. DKA can show up with stomach pain, fast, deep breathing, and a kind of fruity smell on the breath. That is emergency care right now. Second, sugar is too low. If you're on insulin or certain older diabetes pills and you get shaky, sweaty, confused, slurred, hard to wake, that's also an emergency. Very low sugar can drop you fast.
Okay, long term. If someone says, I feel fine, I'll deal with it later. What actually happens if they ignore diabetes?
High sugar, left alone, quietly damages blood vessels and nerves everywhere in the body. That means higher risk of heart attack and stroke. It means kidney damage that can lead to dialysis. It means eye damage and vision loss. It means nerve damage in the feet, ulcers, infections, sometimes amputation. And it's not just the body. Long-term uncontrolled diabetes also raises your risk of memory and thinking problems later in life.
Let's talk treatment. I sit down in clinic, you tell me, yes, you have type 2 diabetes. What's step 1?
Step 1 is how you live. I don't mean a crash diet for 2 weeks. I mean something you can actually keep going. We work on bringing weight down if you're above a healthy range, because even a modest amount of weight loss helps your body use insulin better. This is not about being skinny for looks. This is about getting your cells to listen to insulin again and protecting your future heart, kidneys, and nerves.
What about food specifically?
We shift your pattern. More vegetables, more fiber, more lean protein, more healthy fats, less constant refined carbs and sugar drinks. We want to smooth out the sugar spikes, not starve you. We also work on sleep and stress, because bad sleep and nonstop stress both push sugar higher. Lifestyle is not optional. Lifestyle is first-line treatment. It never stops.
That's lifestyle, but people are going to ask, am I getting medication?
Maybe, yes. One very common first medicine is metformin. It helps lower blood sugar and it's generally safe and affordable.
But now we hear about these newer meds, shots, weekly pens, heart protection, kidney protection. Can you explain that in normal language?
Sure. If you already have heart disease, heart failure, or kidney problems, we don't wait anymore. We often start early on medicines that do more than just lower sugar. Two big types are SGLT2 inhibitors and GLP-1 medicines. These can help protect the heart, help protect the kidneys, and many of the GLP-1 type meds also help with weight. We've seen they can lower the risk of being hospitalized for heart failure and slow down kidney damage. That's why we use them early in higher risk people.
Do you put everybody on insulin right away?
No, insulin is absolutely life-saving when sugars are extremely high at the start, or you're getting sick, or you're losing weight fast, or we're worried about something like DKA. In that situation, insulin is rescue. But if you're more stable type 2, we don't automatically jump to insulin on day 1. We can often try those newer medicines first, if they're safe for you and you can get them, because they control sugar, they help with weight, and they usually have less risk of dangerous low sugar.
All right, I'm on treatment now. What am I supposed to check at home? How do I know if I'm doing okay?
Let's make this simple. First, daily sugar. If you're on insulin or a medicine that can cause low sugar, you should be checking at home, finger sticks, or a continuous glucose monitor. I'll give you real targets. Before you eat, especially first thing in the morning before breakfast, we usually want you roughly in the 80 to 130 range. That's your fasting or pre-meal goal. About 1 to 2 hours after you start eating, we usually want you under 180. Those are common safe targets for many adults with type 2 diabetes. We're not chasing perfect, we're staying in a range that protects you without crashing you low. Second, your A1C. A1C is your 3-month average. For a lot of adults, we aim for under 7%. Some people get a tighter goal. Some people, especially older adults, or people who get low sugars easily, get a slightly looser goal on purpose. Maybe a little above 7, because safety matters more than a pretty number. We usually recheck A1C every 3 months until you're steady, then every 6 months.
So it's not just the finger stick number, you're watching the long-term score too.
Exactly. Day-to-day tells us how are you right now. A1C tells us how have you been living the last 3 months.
You always talk about kidneys, eyes, and feet. Why is that part of the follow-up?
Because diabetes doesn't hit just one organ. We watch your blood pressure and cholesterol. We check your kidneys and urine for early kidney damage. We check your eyes every year to catch vision damage before you notice it. We check your feet for numbness or slow healing spots so we can stop ulcers and infections early. The goal is not just lower sugar. The goal is protect your heart, protect your kidneys, protect your nerves, protect your eyes.
How often do you want to see someone with diabetes? Is this see you next year, or is it closer than that?
In the beginning, it's close. If your sugars are high or we just changed your medication, I don't want to see you in a year. I want to see you in a few weeks to about a month. We adjust, we make sure you're not having dangerous lows, and we make sure you're not overwhelmed. Once you're stable, sugars in range, A1C on target, blood pressure controlled, kidneys and eyes looking okay, then most people can come every 3 to 6 months. This is not, here's a pill, good luck. This is teamwork.
Talk to the person watching who's thinking, okay, but I feel fine. I'm not worried.
That's honestly the person I worry about most. Type 2 diabetes can stay quiet for years while it's already hurting your heart, kidneys, nerves, and eyes. But here's the good news. We are better at treating this than ever. We're not just lowering sugar, we're protecting your heart and protecting your kidneys at the same time. That's the modern way to treat diabetes.
Give us the short summary.
Diabetes means your sugar runs too high for too long. We diagnose it with lab numbers. A1C 6.5 or higher, fasting sugar 126 or higher, a 2-hour sugar 200 or higher, or a random sugar 200 or higher with classic symptoms. If you ignore it, it can lead to heart attack, stroke, kidney failure, vision loss, nerve damage, and memory problems later in life. Treatment today is not, here's insulin, goodbye. It's a plan you can actually live with. Steady eating pattern, weight management if you need it, sleep, stress control, and smart medication. Sometimes that's metformin. Sometimes that's newer medicine that also protects your heart and kidneys at the same time. That's the modern way to treat diabetes.
Thank you, Doctor. And thank you for watching Dr. Health Hub, where every episode begins with a doctor tip you can trust. Your health is your wealth. Stay tuned for the next doctor tip you can trust.